Today on the 01581 Let's Talk, a conversation with Senator Michael Moore. Hi, and welcome to this episode of the 01581 Let's Talk. I'm the host of this show, Shelby Marshall, also serving as a select board member. And the goal of this show really is to make you aware of important things going on around town, things that affect your taxes, as well as things and events you might be interested in attending to build community, and certainly to connect you to people you should know. And one of those people you should know is our Senator Michael Moore. He's been a regular guest on this show last year, and I'm excited that he's agreed to continue his appearances. So welcome.
Welcome. Thank you. And thank you for letting me be on the show.
Yeah, so, excited.
It's always nice to come out.
Yeah, absolutely. And it was great to see you. Thank you so much for attending the Martin Luther King Jr. Celebration event yesterday. Thank you, and to Rep. Donahue for being there. It was great to see you, and really appreciated your comments.
No, thank you. It's actually nice to have communities recognize these events. You know, like I said yesterday, it's great that we go to these events, but if we go and there's no one there, it kind of defeats the purposes. So it's nice to see that such community support for it also.
Yeah, and I was roughly counting. I think we probably had about 100 people there. There might have been more with the kids in the other room that I didn't see.
Oh, yeah, sure.
So I thought it was great. So anyway, all right, down to business. It's a new calendar year.
We've got some new things this year.
A lot of new things going on, and we're going to keep this conversation local because I'm going to stay in a place of hope right now. Okay.
Can I just one comment?
Yeah. Okay. Are you going to bring me down?
No. I'm just going to say, regardless of which side you were on in this past election, let's hope everyone stays together and works together. That's the ultimate. Because we want to make sure whatever administration is in there, it's going to be successful for the betterment of everyone. So let's everyone stay positive.
Absolutely. And working together, because it really is all about compromise, because we're, we don't all necessarily want, the same thing, but we probably want something kind of at least surrounding that issue.
Right. So it's all about getting to the ultimate goal, and how you get there can be different.
Right.
But so is that positive enough?
Yeah. All right. I'll fine. Yes. Okay. So we got a couple important bills. We're also going to talk about kind of the bill process. I think every time you're here, I certainly learn something. Hopefully our viewers do as well, in terms of, we sort of say all these different bills. So we'll pause that for just a moment. We'll talk about these, and then we'll finish up on that.
Sounds good.
All right. One of the a bill that was recently signed by the governor is the school bus traffic safety camera bill. I know that this one is near and dear to your heart.
Yes.
So what is it, and why were you a supporter of it?
Well, so basically what this does, it allows municipalities by a vote of the school committee. So the local school district, by a vote of the school committee, can authorize the buses to have cameras. Right now, prior to this, it was against the law. It was prohibited.
Okay.
Now with a vote, they can authorize the city of Worcester, for example, they own their own buses. So they can install these buses with cameras. Municipalities that don't can authorize their whoever their vendor is. But basically what happens, I had a former school committee member from the city of Worcester reach out to me, and this was about a year and a half ago, and talked about the problem that they were having with people that were just violating the law, where you had to stop for a school bus when the stop sign comes out. I, being fully supportive of the school committee, filed the legislation, and I didn't really...
And also practical law, right?
Yes.
The stop sign is out. There are children. Maybe we should stop, right?
I mean, it's kind of thing,
I'm sorry you had to waste your time with this, right?
Well, I thought back to when we went to driver's ed. It's like one of those main things that you're taught. It's just, a school bus.
Yeah, school bus. School bus and railroad tracks, right?
Yes, yeah. But I didn't really realize the gravity of the violations. So one community, the city of Peabody, from September 1st, 2023 to October 10th of 2023, did a pilot program. They were authorized to do a pilot program. They did not issue any violations. It was just to document violations. In a 6-week period, they had 864 violations.
In a 6-week period?
864 violations. So having that data, it helps get this legislation passed.
Wow.
Yeah, yes. So so we put, look, obviously we have concerns about technology and the use of it and safeguards.
Yeah.
So we have requirements on how long police can keep the video.
Yep.
The video link will go from
That's what I was
the
gonna ask.
platform
Yep.
to the police department.
Okay.
They
Yep.
will review it.
Yep.
If they determine it's not a violation, then they can only maintain the video for 30 days.
Okay.
If they determine it is, they can keep it until 1 year after the resolution of it. So
Okay.
basically, if you get found
Okay.
guilty of
Yep.
this,
Yep.
they can hold it for 1 year.
Okay.
And
Yeah, so
This-
if you
this
become a
was-
second offender.
a second offender,
yeah,
or
yeah.
if you want to appeal it,
Yep,
and you keep the
yep,
process.
yep.
And
Wow.
and we also have in this that municipalities
Mm-hmm.
cannot use this as a revenue enhancement, and how we restrict that
Okay.
is we make sure that when they're negotiating their contract with the vendor,
Okay.
the revenues brought in to the municipality
Mm-hmm.
cannot be a factor in the negotiations. It's the only thing that can be looked at is the cost of the platform to the community.
Okay. But the revenue from the fines, from
The
the,
revenues from the fine go back to the city of town.
yep, which
But
would
when you
be standard,
right,
right,
but
right,
when
right.
when you negotiate your contract, you can't be saying, okay, look, it's going to cost us, and I'm just throwing numbers
Yeah,
out there, $10,000,
Yeah, yep.
but we're bringing in $20,000.
Gotcha.
It's got to be looked at. Okay, this is what the costs are.
Yep.
This is,
Understood.
So
I got it.
So we tried to
Awesome.
make this
Okay,
so
yeah.
the whole purpose of this is a public safety measure. It's to make sure that everyone's child who's getting on a bus or off the bus
Yeah.
is safe.
Well, thank you for working on this.
Oh, thank you.
Again, I apologize if I implied that was a waste of your time, because
Oh, no,
child
no,
safety
yeah.
isn't, and public safety isn't, but it is, it's frustrating, the fact that people wouldn't pay attention to signs, but
Yeah,
that
especially-
study is
and-
unbelievable.
And again, especially regarding kids. I mean, in the age of the children that you have getting on the
Yeah,
buses,
yeah.
it's not like every child is a senior or someone in high school. You've got young kids that,
Yeah.
okay, they
Well,
get off
and
the
kinda
bus,
get off the bus, and they're like looking at the clouds
Yeah.
and everything else.
and they're excited. They see their parents, or they see their pet dog over
Of
there, and they go
course.
running across the street.
Right, and yeah, and God forbid anyone were to do that. I mean, talk about changing your life in an instant if you're that driver. So,
Yeah.
so pay attention, folks. Legislation now would allow cameras on a school bus. Do you know offhand if the Westboro School Committee has conversations
don't.
about taking this up?
I haven't.
Okay.
Again, this just passed the end of December.
Yeah, okay.
So, and another thing that I should make known that this is not a mandate.
Yep.
So we'll leave it up to every city and town.
Sure.
I know every time we pass something, it's everything. So okay, so the state come forward with the
Yeah,
funding.
and now we gotta fund it.
Now,
Right,
so
right,
it's
right.
up to the
Yep.
municipality whether they want to fund this or
Okay.
not, because because we're not
Sure.
mandating it, so
Sure.
it wouldn't fall underneath the local mandate section of the law.
And I'm curious, because school transportation is such a hot topic in the
Yeah.
Commonwealth. Is there a requirement in the legislation, like can a school bus company oppose cameras? Or is there, like, if the
Well, I don't know.
municipality passes it,
I don't know how, because it would be the contract the municipality puts out.
Okay.
So if you do the RFP,
Yep.
and part of the so an RFP is request for proposal. So if the city or town puts out an RFP and they include that in the bid,
is a requirement, yeah.
it's a requirement,
yeah,
then they would have to.
Okay, yeah.
So there's also another, and actually I just thought as you were talking, there's
Yeah.
also another piece of legislation that's separate from this that allows the regional transportation systems.
Oh,
So
like
the-
WRTA?
Right, the
Yep,
MBTA,
yep.
WRTA, so the regional transportation systems can also,
Okay.
they were authorized that
To
if
do
they
the
wanted,
same.
yeah. And actually Worcester, it was funny after this, sorry, I don't want to say it was funny.
Yeah.
Sadly, right after this was signed, there was actually someone who was getting off a RTA bus in Worcester and was killed. So I don't know where that's going to factor into
Yeah,
what
yeah.
the city's going to do.
Yeah, well.
Yeah.
Okay, all right. Well, from buses to pharma cost reform bill, which was signed by the governor on January 9th. So I'll just read here. So Governor Healy signed into law comprehensive reforms to lower the cost of prescription drugs at the pharmacy counter and improve the oversight of the state's pharmaceutical industry. The bill requires health insurers to cover life-saving medications for diabetes, asthma, and certain heart conditions with no or limited out-of-pocket costs for patients. The measure is particularly critical for residents of color who disproportionately face chronic illnesses. So one of the things I thought was interesting is that so lower pocket out-of-costs for a number of different conditions, and to eliminate cost-sharing requirements for one generic drug and to cap co-payments on one brand name drug at $25 per 30-day supply.
Yep.
That last one there, I mean, again, maybe the devil's in the details, is huge. I mean, diabetic medication can cost hundreds of dollars a month for a 30-day supply. Do you know if, just so I understand, one brand name drug at $25 per 30-day supply, so it's every 30-day supply, that one drug?
Right.
Is that, wow.
Yeah.
Okay.
So this is one of the things, and I don't want to get into the politics of everything,
Yeah.
but everyone talks about, we don't want socialism, we don't want government intervention, but and I guess it all depends how you look at this. But if you deem it socialism, then I guess you do.
Yep.
But to me, I look at this as, how do we have a system, a healthcare system that we always say that the United States is the best in the world, and even Massachusetts. But how do we have a system that we actually allowed life-saving medication? This isn't like insulin, or this isn't where you look at insulin, diabetes, asthma.
COPD, yep.
These are life-saving medications, and they're being charged at a rate that people can't afford.
Right.
I mean, that's ridiculous.
Right.
So this was a long time coming.
Yeah.
I'm happy to see that it went through.
Yeah.
Another thing that we looked at too with this is years ago there were the PBMs,
Yeah.
pharmacy benefit managers, that were supposed to be like
I used to work for one.
Oh, well, they
Yeah.
were supposed to be.
Yeah.
They were brought in with the concept they were going to negotiate and bring that cost down.
Right.
We haven't seen that. It's
Right.
actually gone the other way.
Right.
So this actually puts some regulations regarding how they operate.
Yeah.
So hopefully we'll see a little better working with the system, and the Health Policy Commission in Massachusetts will now oversee them.
It's
So-
interesting to me that, and I'll be honest with you, I wasn't aware of it until I heard conversations about this bill, that, I mean, health plans are obviously regulated by the state,
Right.
that heavily regulated, that PBMs were not licensed and regulated by the state.
Yeah.
I don't know, again, the things that we assume, so the fact that we're pulling that under that regulatory, I mean, I'm sure the shareholders are not pleased, but this to me is a no-brainer.
Yeah.
It's an absolute no-brainer.
This is so often where we'll hear from constituents on, regulation and how it adds costs to whatever industry.
Yeah.
But then so often that when we don't have the regulation, then we'll have these very...
Well, they're unchecked.
Well, but then we have people come back saying, well, this is what government should be regulating this.
Right.
So then, you try to find that middle ground where,
Yeah.
okay, you have an industry that comes in,
Yeah.
you try to help get it established, try to, make sure it's to the benefit of the public.
Right.
But then no one wants regulation, but then when there's no check on it,
Right.
we end up having a process
Yeah.
where the ultimate goal was to keep prices lower.
Yeah.
It didn't work.
Yeah.
So,
And it's incredibly hard, I know firsthand from being a family caregiver, it's incredibly hard as pharmacy benefits through the PBM or the health plan, sometimes both, are, shift, and then you can't get this, if you want this drug, it's gonna cost you this much, or you can't even get it. I mean, the oversight is so desperately needed, I can tell you. It's, and it's very frustrating, both the cost of it as well as the process. I was also excited to see that in this legislation that pharmaceutical manufacturers and PBMs are now going to be included in the Health Policy Commission's annual healthcare cost trends.
Yeah.
So I'm pretty sure that hospital systems, that was one of my gripes back when the partner system wanted to come here, But hospital systems are part of that, health plans, I
Right.
believe that they all fall under that umbrella,
Yeah.
and it's fitting that PBMs would be there too.
Yeah.
Yeah,
So
good.
that was what I was just going to come to.
Oh,
was the
sorry,
fact-
yeah.
No, I'm glad you brought it up. The fact that now there's going to be some data that's going to be forced to
Yep.
provide.
Yep.
So now we'll have the oversight,
Yep.
there'll be evidence-based type of decisions and regulations. So hopefully, the ultimate goal in stabilizing costs or bringing some of the costs
Yeah.
down.
Well, and it gives the PBMs a seat at the table to actually, to be able to present the data and to be able to kind of talk about those influencing factors. Okay, great. All right. Let's see here.
Can I
Yeah,
put one other
yeah,
thing too,
please.
and I know people might be seeing it because it was just in the Boston Globe, so this is a little off, but the Healy administration just negotiated with the Biden administration before they left.
Okay.
Back under, this was during the pandemic,
Okay.
but when the previous Baker administration was in office, they used pandemic-related funds to pay for unemployment claims.
Okay. Yep.
And the federal government determined that it was an unauthorized or inappropriate use of those funds.
Okay.
So we haven't gotten all the full details yet, but the administration just agreed to a settlement
Okay.
with the Biden administration that we apparently we owe $2.5 billion. So apparently, so just reading from the media, what's in the article, that I guess it's a 5-year settlement. So I'm assuming we're going to get more details this week when we get
Okay.
in. But this was something this was an administrative type action.
Yeah.
It wasn't the legislative. So
Yeah.
we'll have to find out what the payment plan is going to be. So
Are
so
we the
that's-
only state that ran into that? I would imagine.
I
you
don't know. I know we've been waiting to hear. We've been waiting to hear what the federal response or requirement was going to be, because we heard about this
It's
before the change of administration. I shouldn't say here. We were told.
Yeah.
But then we went quiet for a while, and we've asked, and we just weren't getting anything back. And now the administration, the Healy Driscoll administration, put out what they've agreed to as far as the negotiated settlement.
Yeah.
So.
Well, obviously, it's something that's been been discussed and worked on. It's interesting to me that given the nature of the pandemic and the relationship to unemployment, that would have been that's even an issue. But again, people are much more involved and made that decision, and so we'll go from there. Okay. So there's also another healthcare-related bill signed by the governor that is going to close loopholes in the healthcare market regulatory process exposed by the collapse of Steward Healthcare, which increases financial transparency by gathering more information regarding hospital finances and will assist in maintaining a more stable and sustainable healthcare system. So, thoughts on that?
I think it's great. I think we've all seen what the results were from having an unregulated or unchecked system.
Yeah.
So again, now we have to make sure that our healthcare system, because it is so vitally important to our constituents, to everyone, that we have the proper safeguards in. And we can't have a hospital system, for-profit or not-for-profit, that's operating in a manner that's going to jeopardize access to healthcare.
Yeah.
I think it was in Bolton, or in that area of Worcester, northeast Worcester County, that their facility closed. Now there's no health care.
Right.
So they've got to come all the way into Worcester now.
Yeah.
We can't be having gaps
Yeah.
like this. And
Yeah,
there
medical deserts,
there were some reporting requirements that they weren't complying with. So now, hopefully, with the change of this and strengthening the system, and again, this is going to be overseen by CHIA and the Center for Health Analysis Information. So,
And
for Health Policy Commission.
And is that, where does that fall? Is there legislative oversight in here? Is that executive appointed, like under these, or these are established? What is CHIA, I guess is my question.
So that would be their appointments by the administration. The
Okay.
legislature doesn't get involved. And even like the auditor.
100% appointments, or some of these like state?
Oh, no, the auditor
Okay.
also has an appointment on there.
okay.
So the administration does, the auditor does, and I'm forgetting who else has. It's almost similar to the gaming commission.
Okay.
So the gaming commission, the governor appoints one, the
Okay, yeah,
treasurer
yeah,
appoints
yeah.
one,
Okay.
I'm trying to think who the other person. Oh, the attorney general appoints one.
Okay.
So it invests appointing
Yeah.
authority to different agencies.
Interesting. Okay. Okay. All right. And so there is also, again, in healthcare, a bill passed by the legislature on breast cancer screening.
Right. Yep.
So it's going to require insurance providers, including GIC and Mass Health, to provide coverage for diagnostic breast cancer, digital breast tomosynthesis
Thank you. You're trying that one.
screening. I hope I did that right. My friends in the healthcare field would be like, that's not how you say it. And medically necessary appropriate screening with breast magnetic resonance imaging. So the point here, I guess, is that the Affordable Care Act provides coverage for
Right.
this, but this legislation goes further to require it for certain screening and exams not uniformly covered by the Affordable Care Act.
Correct.
Okay,
Yep.
great. And then just from a statistic perspective, according to Mass Department of Public Health, breast cancer was a leading cancer cause among Massachusetts females between 2016 and 2020, accounting for over 30% of all new cancer diagnoses, affecting more than 30,000 individuals, and over 4,000 Massachusetts residents lost their lives to breast cancer in that time period. So early detection is so important, and
Yeah.
combining that with targeted therapies, people are living longer, and hopefully this legislation will help for that. So, and this was signed into law by Governor Haley on November 13th, 2024. Let's transition in the remaining time we have here into that part I asked you about in the beginning, which is the bill process. So as we were sitting down to get ready to tape the show, I was mentioning to you that there was a local resident here had shared that there is a bill that's been introduced for phone-free schools.
Right.
This bill has been introduced by the Attorney General, Andrea Campbell, Senator Julian Sear, Reps Peach, I hope I'm saying her name right, and Kipper Garabedian. So I said to you, what do you know about this? And you said,
Nothing.
nothing, right? And so that led us to kind of this part of the conversation, which is, what is that bill introduction process? Like, okay, great, it's been introduced, but then you said, Shelby, I just introduced 100 bills.
Yeah.
So walk us through that, please.
So basically, the Constitution requires the legislature to be sworn in on the first Wednesday in January.
Yes, love those pictures.
Yep, yep.
Congratulations
Oh,
again.
Thank you, thank
Yeah.
you. And actually, this year it happened to be on New Year's Day.
Yeah.
So we were all in there New Year's Day. Well, right after that, you have the bill filing period.
Mm-hmm.
So that went from the beginning of the session to January 17th.
Mm-hmm.
So last Friday at 5 o'clock was the filing deadline.
Okay.
So now, I don't have the total yet. The last legislative session, there were 6,500 bills filed. So I'm going to imagine there's at least 6,500
Yep.
bills filed. So, yeah, so
And when you say, is this Senate and House?
Senate and House,
Okay,
yeah.
come on.
Yeah.
Okay, yep.
So now, again, that number may reduce because many times when I'm filing a bill,
Sure.
we're looking for a House co-sponsor. This way you can try to...
As I
get-
just mentioned with this one.
Right.
So,
You can get the bill, hopefully if you can't get passed in the Senate, the House will pass it, and then it puts pressure on the Senate,
Yeah.
and then vice versa.
Yeah.
So I don't have a number yet. So most likely that was probably, if that would happen, it was filed by 5 o'clock on Friday. We haven't got a breakdown yet. Now, of the bills that were filed in what committees. So now what happens is the clerk the House clerk and the Senate clerk, they'll sit down at a table and they'll look at the title of the bill and a little summary, and they'll
Yeah.
determine what committee of jurisdiction that bill will be referred to. And then once that's done, then every bill has to receive a hearing. So the committees, committee chairmanships haven't been established yet.
Yeah,
So
okay.
between now and committee chairmanships are established after there's an agreement between the House and Senate on joint rules.
Okay.
So at that point, but in the meantime, the Senate and the House clerk will sit down and they'll send the bills, the legislation
Yep.
to the individual committees.
Okay.
And once that's done, then we have until this past session, you have until February, I think it was February 10th or something like that.
To mid-February.
Yeah, to mid-February, for a bill to have a hearing and to get reported out.
Okay.
There's been discussions, the Senate President and
I
the
was going to
Speaker
ask you, I think you're going here, yeah.
have both agreed, because there was such a delay in bills being released committees, of pushing that up until sometime at the end of this calendar year. So,
Oh, really?
yes,
So, to like December?
to like December or
Oh.
maybe November, so that this way, because right now it goes.
For the first hearing?
No, for the
Oh,
bill to
sorry.
be released from the committee will have to have voted
I'm
to
sorry.
favorably
Okay.
report the bill, unfavorably report it, send it to study.
Okay.
So.
So
they're
is that speeding up the timeline or slowing it down?
speeding it up.
Oh, okay.
It's moving it up so that they
Okay.
because right now, if you went by last year's rules, you have until February of the next year.
Oh, okay. I'm sorry, I missed that. I got it.
Yeah.
Okay.
So,
Okay.
hopefully we'll see that pushed up a little bit, and this way, we had the last month or 2 months in informal session. The governor had in December 122 bills that went to them that were, and my camera bill was one of them that was finalized in informal session.
Yep.
So hopefully by doing this,
Yeah, you don't get that crush.
Right.
Yeah.
So.
Where I thought you were going with the Senate President is in the House Rep. What is the House Chair called?
It's Speaker.
Speaker. Thank you.
Okay.
Is, I believe, at the end of last year, calendar year, there was a commitment by both of them around open meetings, around hearings or something. There was I felt like they came out with a statement saying, and we are supportive of increasing transparency.
I was going to say transparency. Well, it might be, but it might be the recording of votes. So right now, the Senate had in the
Okay.
rules that when a vote was taken, we would record the votes of the members.
Okay.
The House didn't have that. So maybe it might be more
Okay.
that.
All right.
So
That's your
when-
homework assignment. Understand about the.
This is where right now we won't find out. I mean, we'll get updates as far as how the negotiations are going.
Yeah.
So actually, I did one of the pieces of legislation I did file.
Yep.
This year, out of the 101, 102, I took some of the issues that were talked about, as far as transparency, the recording of votes, sharing the authority about when a bill can be sent for a vote. Right now, there's nothing in there that says, in the past, we had it where the Senate chair and the House chair,
Yep.
if you wanted to send a bill out for a vote, you would have to negotiate and say, okay, you both would have to agree before a bill could be sent out for a vote. And that actually gave both branches the opportunity for you and I, if the House had a certain piece of legislation
Sure.
that they wanted to enact, I could say, okay, fine, all right, but the Senate or the committee on the Senate side would like to see this. So there's some compromise.
Sure.
Because right now the House outnumbers the Senate by 2-1 on these committees. So in theory, the House can
got it.
control everything.
Yeah.
So I actually did file some legislation this year, which is not normally done, that would put in statute that some of these transparency measures. So I've yet to
Okay.
see a reaction yet.
All
'cause
right.
it was
Well,
getting-
look forward to more updates on that.
right, thank
I'll
you.
go back and do my homework as well. But I almost took it as that whatever it was increased transparency, and maybe it was on recording the votes. I felt like it was actual visibility to some of the hearings or something. But I don't know. Well, I'll
Well, we have, so right now, the hearings can be attended since the pandemic,
yeah, virtual.
virtually
Yeah.
or in person.
Yeah.
Prior to that, everything had to be done in person.
In person, yeah.
So we've
Yeah.
actually kept that
Yeah,
for the
yeah.
joint committee hearings. That has been in place for the last 4 or 5 years.
Speaking of which, do you have a sense, because I think that the hybrid, all of that, kind of as it affects municipalities, I feel like that runs out, the current governor order, in March. Do you have
Oh,
a
okay.
sense of where, all right,
Oh, no,
homework.
no, that's
More
homework. Yeah, that's homework. Okay.
Okay, all right,
Yeah.
homework, all right, okay. Okay, So you've introduced 100 bills. We're gonna figure out whether or not maybe some of those are shared jointly, or interests are shared jointly with the House.
Right.
And so then they get assigned to committees. In the meantime, chairs of those committees are being determined.
The
for
Senate
both-
President will
Yep.
determine in the Senate who they want to chair in certain
Okay.
committees.
And we've got the
then the
rules.
House, yeah, then the rules.
Okay.
Now,
And then deliberations begin
Yes.
within those committees?
Yep.
Okay, okay.
yeah. So actually, one other piece of legislation I did file that actually we actually saw passed in California has to deal with AI and healthcare. So a lot of I have several big pieces because where I chaired the Artificial Intelligence
Yes,
Committee last
yep.
session. One of my that we filed deals with healthcare and making sure that if AI, artificial intelligence, is used, that there has to be a final review by
A human?
human.
Oh,
So
Okay,
because
interesting.
that's a big concern. All the different
sure.
professional development that I've gone through, I always said, AI is great,
Yep.
but you got to make sure the final analysis or the final
Yep.
determination has human
Sure,
oversight.
sure.
So that's something that we actually got from passage in California.
Two questions. One, so what's the process like? So you were chair of different committees in the
Right.
past.
Yep.
Tell us what that inside part, like, do you slide a note to someone and say, here are the
So
top
so
three
this-
committees I want?
So,
Like,
well, actually, that's pretty much the Senate President puts out.
here's the team I want to be on? What
Yeah,
happens?
the Senate President puts out a list,
Okay.
put the document. You put the committees you'd like to chair.
Okay.
And then committees you'd like to sit on as a member.
Okay,
And then you just hope that, whatever committee.
Okay.
So I chaired the Committee on Higher Education for 6 years.
okay,
At one point, then the Committee on Public Safety, the chairman there didn't run for office, so
Yep.
I
yep,
then asked for that committee. I
Yeah,
got
you've
that
got
committee.
some history
and then,
for- yeah,
right,
yeah,
so then
yeah.
from there, I went from public safety to the internet, artificial
Yeah.
intelligence, but I stayed a member on the public safety
okay,
committee.
okay.
So
And do you have a limit on how many committees you can chair? First question.
usually you may chair, you'll chair one committee.
Okay.
Sometimes you'll have two.
Okay, okay, so 1 to 2.
Yeah, and then you have a vice chairmanship.
Yep.
So the last couple of years, I've been vice chair of financial services.
Okay.
So
Okay. All right. And how many other committees can you sit on being named? Is it limited?
I was on 3 other committees.
Okay.
As a committee member.
Okay. All right. Okay. I think it's interesting for the public to understand kind of what that process is. And
Yeah, so that, and then there are some committees that are joint committees. That means it's one committee, but you have Senate members and you have House members. You have a Senate chair and a House chair. Then you have standalone committees,
Okay.
which means that it's just, I actually chaired bonding one year.
Okay.
One session, I should say. So bonding is a standalone where there's just Senate members on it.
Okay.
So when a bond bill goes from the governor to the House, their House bonding committee will review it. Then it goes to the Ways and Means, or if it's a transportation bond bill, it could go to the Committee of Jurisdiction.
Yep.
And then it goes to Ways and Means, then to the floor. Then that would come over to the Senate. And then if it's a standalone committee, just those senators on that committee will get it, review it, and then send it again to the policy committee. Yeah.
Interesting.
Yeah,
Okay.
so it's it can be a long process.
Yeah. All right. Thank you. All right. Kind of personal question. What are you optimistic about this year as you started a new session? You're in a new term. What are you optimistic about professionally and personally?
Professionally, I'm hoping that there's several pieces of legislation that we can get some movement on and getting it passed. And whether it's individual bills or whether it's getting larger bills amended. I have several of them that, with the artificial intelligence that
Sure.
I'm hoping that we'd like to see from.
Always tweaking, refining, learning.
Well, but
Yeah.
also, we've got a comprehensive bill establishing a regulatory body dealing with cyber breaches. Then we've got another one dealing with data privacy.
Yeah.
So if I can get some movement on those, that would be great.
Okay.
Personally, just seeing what comes up, and if we can address the issues as they move forward. So this is like talking about the unemployment. So here we have an issue that, we knew it was pending. Everyone knew, but nothing had come down. So we kind of have to be able to be flexible enough to switch priorities.
Yep. You mean from a federal level down to?
Well, that's on the state level.
Okay.
So now that, that wasn't even on the radar right now.
Okay.
Now it's a state issue that we've got to look at.
Got it.
So one thing coming up is the whole migrant issue.
Yes.
So we've got a supplemental budget coming up.
Okay.
The administration is looking for, I think, $400 million. That has another $200 or $300 million to deal with the cost of the migrants. So I've got several pieces of I got several concepts that we're going to be looking to do as amendments. So I guess on the professional level, just getting some of these, as these new issues arise, just being flexible enough that we can try to address these issues and
Sure.
and
It's a lot.
doing it in a way that's really going to hopefully benefit your constituents.
All right, good. All right, well, hopefully make some time for fun amidst all of this, because it's serious work, so thank you for doing it.
Oh, no,
Thank
my
you for
pleasure.
being
Thank you.
on. See you on your next appearance. I appreciate your flexibility. We're going to have our representatives kind of fill in as well, so
Yep.
give them an opportunity to connect with the public. And so thank you. We'll see you again soon.
See you again soon.
Awesome.
Thank you.
Thank you so much for tuning in to this episode of the 01581 Let's Talk. If you have any questions for our senator, he and members of his staff remain accessible to you always, and you can contact them through the email address that our friends at Westboro TV will put on the bottom of the screen. So thank you so much. Have a great week. Take care of each other. Do something good in the world, and be well. Thanks.